Welcome to the National Retirees Legislative Network podcast produced by and for America's retirees and those over age 50 everywhere. I'm Bill Catterite, president of the NRLN and your podcast host. If you're listening to this podcast, go to www.nrln.org and click the NRLN videos and podcast color icon in the middle of our homepage. Then select episode number 3 to view this video, including tables and charts. On the www.nrln.org taskbar, click Contact Us on the tab, then contact the NRLN, where you can send an email or call toll-free at 866-360-7197. Offer comments, questions, and suggestions. Today, in episode 3, we will examine revenue sources for Medicare Parts A, B, and D, and examine the impact that increased Medicare enrollment and out-of-control healthcare costs will have on retirees. This chart shows us where Medicare revenue comes from. The first stack on the left of this chart shows that 43% of Medicare's total revenue in 2018 came from general revenue or income taxes, not payroll tax revenue. It's not Medicare that's going broke by 2028. It's Medicare Part A that is in trouble. Medicare Part A's trust fund may be insolvent by 2028. Proposed alternatives are to raise taxes and or cut benefits by 17%. The second stack on the chart shows where Part A revenue comes from. 88% of the Medicare Part A revenue of $307 billion in 2018 came from a 1.45% payroll tax that you're aware of, but it's not enough to cover rapid growth of Medicare enrollees. The Part A problem is very serious, but the elephant in the room is not Part A. The third stack on the chart reveals that Congress used general revenue to fund 72% of Part B's $350 billion, and on the fourth stack, 71% of Part D's $95 billion. Congress knows that paying 72% of Part B and 71% of Part D combined used up almost $330 billion of general revenue in 2018. That's projected to double to $660 billion by 2029. This $660 billion is the elephant in the room. Congress has chosen to fund private insurance company rebates, hoping they could reduce costs and privatize Medicare. CMS has paid over $450 billion since 1997, plus $38 billion in 2020 alone on rebates. Congress has doubled down on their hopes that Medicare privatization will take this cost problem off their plate. But poor Medicare Advantage results tell us this is just a pipe dream. The MedPAC trustees, the General Accounting Office, NRLN, and others have been critical of the Medicare Advantage Quality Bonus Plan and the 5-star rating system and rebates. Congress, the CMS, and insurance companies have ignored pleas to legitimize the Quality Bonus Plan. This chart provides some information. It says by 2016, Congress and CMS reduced rebates as required by law to a low of $81 per enrollee, and plan payments to insurers down to 8% in 2016. However, Congress then, over the next 4 years, authorized new Medicare Advantage plan benefits and a 51% rebate increase from $81 to $122 a month per enrollee. That amounts to $1,465 a year this year in 2020. This 4-year action was tantamount to an open admission that the true purpose for privatization was not to reduce Medicare costs, but to eventually reduce the federal budget and shift the costs to retirees. On the next chart, there is a stack bar for each year, 2016 through 2020. Market share is calculated as the number of Medicare Advantage plan enrollees divided by the total number of Medicare enrollees. This percentage data is shown above each stack. The monthly average Medicare Advantage rebate dollars paid to insurance companies per enrollee are placed inside the top of the black section on this chart. As you can see, rebates have grown from $81 to $122 per enrollee. Rebate payments at the top of the gold section grew from 8% of total payments to 13% by 2020. This chart also reveals that Medicare Advantage plans gained just 7.7% in Medicare market share over these 4 years. Not a good performance, especially since rebates up to $1,465 annually per enrollee were awarded to offset Medicare Advantage plan costs, overhead, and profit, costing taxpayers $38 billion this year. Healthcare insurance companies have not made significant inroads in improving enrollee health. Services like silver sneakers, rides to the doctor's office, telehealth, and wonky PR nonsense increase costs and are paid for with taxpayer rebates. Our final chart reveals 2020 Medicare trustee budget data that projects the cost of health care to rise from $796 in 2019 to $1.5 trillion by 2029. All other things being equal, that will require 44% of $1.5 trillion, or $660 billion, that will have to be paid from general revenue. As mentioned earlier, this $660 billion is the elephant in the room. That's why Congress is panicking. They have no new budget funding ideas. The clock is ticking, and a tax increase is unlikely. They're trapped. Privatization of Medicare was to be their salvation plan, but Medicare Advantage plans have proven to be more expensive per enrollee than original Medicare fee-for-service. Congress has decided to throw billions more of taxpayer dollars at the private insurance industry to market Medicare Advantage and hope for the best. Hope is not going to get this job done. Finally, the data summary includes in the chart title that Medicare costs will double from 2019 to 2029. That's up 101%, while new Medicare enrollees increase by only 25%. With cost raising at 4 times the rate that new enrollees are coming on board, we have a national healthcare cost crisis brewing. The net consequence of this is that the cost per enrollee will increase by $7,786 over that 10-year period of time. That's $649 a month in 2029. A 55-year-old today will face this huge increase by age 65 unless Medicare health care costs are reduced significantly. So it should be no surprise that we believe the best way to ensure that Medicare is around for our children, grandchildren, and those that follow is to stop the bleeding by discontinuing rebates. Let the chips fall where they may and attack fee-for-service cost per enrollees, the real enemy. The NRLN supports competition. We just don't support rebates because it's not real competition. The NRLN is your source for truth about retirement benefits crucial to your future well-being and the financial well-being of your children, grandchildren, and our country. Stay current with news that affects you through our emails and on our website at www.nrln.org. There you will find the links to follow us on Facebook and Instagram, and on www.nrln.org, click the NRLN videos and podcast color icon in the middle of our homepage. Then select the podcast or video to play. On www.nrln.org, also, don't forget, click the taskbar, the Contact Us tab, and select Contact the NRLN, where you can send an email or call 866-360-7197. That's 866-360-7197. 7197. Offer suggestions, questions, offer new topics, and sign up to get our NRLN messages, action alerts, and advance information about videos and podcasts. Until next time, stay safe out there and enjoy your life. Seniors are special.